Exercise-induced pulmonary hemorrhage is characterized by the presence of blood that can be detected through a tracheoendoscopic examination, a procedure involving a small camera inserted into the airway, or through a bronchoalveolar lavage, a method of collecting fluid from the lungs after a horse has undergone strenuous exercise. It is a condition that affects the majority of thoroughbreds at some point during their racing careers. Understanding its impact on performance is a critical issue within the horse racing industry. Previous research has suggested that an increase in the severity of EIPH is associated with poorer performance, indicated by a higher likelihood of finishing outside the top 3 positions in a race and lower race earnings. While it is known that the severity and prevalence of EIPH can be related to the total number of races a horse has started, there has been a lack of clarity regarding when thoroughbred racehorses first begin to experience this condition. For over 4 decades, a medication called furosemide has been employed to lessen the severity of EIPH in performance horses. When administered intravenously at a dose of 0.5 to 1.0 milligrams per kilogram of body weight, approximately 4 hours before intense exercise, it has been shown to effectively reduce the severity or occurrence of visible evidence of EIPH in many horses. Studies have indicated that around 68% of horses experience a decrease in the severity of EIPH following pre-race administration of this drug. However, the pre-race use of furosemide in North America has become a subject of increasing debate in recent years. Consequently, it has been prohibited in races for 2-year-olds and in certain high-level races for older horses at numerous racetracks across the United States since 2020 and 2021, respectively. Given these changes and the limited information specifically focused on 2-year-old thoroughbreds, this study aimed to determine the prevalence and severity of EIPH in this young age group in American racehorses. Pre-race furosemide administration appears to lower the probability of EIPH occurrence, but its effect on severity in this age group requires further investigation. The association of EIPH with intermediate race distances and the variability observed across different racetracks highlight the complexity of this condition and the need for ongoing research to better understand and manage it.